Hey everyone, welcome back. Today we are going to talk about sexual health. And this is a topic that maybe you've covered in high school, maybe you haven't talked about this. We're really just going to stick to the basics today. There are more slides in the PowerPoint on Canvas if you want more information. But we're going to, like I said, just stick to the basics. What this is not is kind of a birds and the bees reproduction type course, but we're going to talk more about protection. So if you have questions about reproduction and other things like that, feel free to email me. If I say something in this lesson and it confuses you, certainly reach out and ask me that question, and I'm more than happy to walk you through that. Okay, so today when I talk about sexual behavior, I'm going to talk about it mostly in a physical sense, right? How does it affect our physical body? Things like pregnancy, things like sexually transmitted diseases. But we have to understand that although we're speaking about it physically, we certainly can't compartmentalize sexual behavior to the physical aspect of our wellness wheel. We have to think about how it impacts emotional and spiritual and social, right? And others. So don't compartmentalize this. Realize that it affects many, many other aspects of our health other than just physical. We're going to talk about sexual behavior being two things. We're going to start very quickly with consent and what is consent. And then we're going to move on and spend most of the time today talking about protection. So let's start with consent, right? So what does it mean for something to be consensual? Well, essentially, both parties are agreeing to the behavior, right? So both parties are in agreement. So the next question then is, how do you get consent from somebody? And hopefully you're all thinking, well, you ask them, right? You have a conversation about it. So there's a very good reason that this lesson comes right after the Healthy Relationships lecture, because there should be communication values, right? So sexual behavior should happen within the confines of a healthy relationship, and there should be communication values. If you can't ask for consent, if you can't have that conversation with someone, you really need to reconsider, should you actually be having sex with them? We're going to look at 4 things that are not consent. Okay, so consent is agreement between two people. So what's not considered consent? So first of all, a silence or an action. So somebody doesn't verbally say no, they don't push back, they don't resist, but if they don't give that verbal affirmative yes, that's not consent. Next is implied consent. Maybe you've had sex with the person before. It doesn't give you consent to do it again. There has to be consent every single time, okay? The third is the one that we probably think of the most, and that's incapacitation. If someone is under the influence of any substance, including alcohol, they most likely cannot give consent. A good rule of thumb, I heard someone say this, and I think it's worth passing along. If you would not trust a person to get behind the wheel of a car and drive, you should not have sex with them at that point. They cannot give you consent at that point. Lastly is coercion. If someone is forced, if they're threatened, if they're intimidated, certainly that's not consent. So consent should be affirmative. It should be conscious, and it should certainly be voluntary. This is an important slide. These are our resources related to sexual misconduct on campus. So when you're all back on campus, I want to make you aware of these resources. So we have 2 types of resources on campus. We have what is called confidential in regards to sexual misconduct, and we have what's called the reporting resource. So on the right side of your screen, you will see your confidential resources, the SAFE office, the counseling center, the chaplain's office, and student help. What that means is that if somebody is a victim of sexual misconduct, which is very much a blanket term for sexual harassment, sexual assault, stalking, those all fall under sexual misconduct. If someone was a victim of sexual misconduct and went to one of these 4 offices, they can go without fear that that office is going to report that. Okay, these are confidential offices. They do not have to report to Title IX. They are not obligated by law to report. Now, the resources on the left side of the screen, these are reporting agents. So coaches, the dean of students, residence lives, myself, right, faculty and staff members. If somebody came to me and told me that they were a victim of sexual misconduct, I, by law, have to report that to the Title IX office. Okay, that's our reporting agency on campus. So all the people on the left, they're reporting agents. The people on the right, those are your confidential resources. If somebody just wanted to talk through their thoughts and their choices and their feelings, that's where they would want to go first. I also bring up a few off-campus resources. We have the emergency rooms, you have the sexual assault response program. That's because student health does not collect evidence, so they cannot do a rape kit if someone's sexually assaulted. So if somebody wanted to have evidence collected to press charges, they would need to go to an emergency room to do so. All right, we're going to move on and talk about protection. So we're talking about protection from two things, right? We're talking about contraception, which is preventing pregnancy, and we're also talking about protection against sexually transmitted diseases. So STD and STI, sexually transmitted infections, are synonymous terms. They're the same thing. So I may use them interchangeably. Just realize that they're actually the same term. So let's talk about contraception first. So contraception is anything that prevents pregnancy, right? So conception is where the sperm and the egg meet. So contraception is anything that prevents that. Sometimes we say the term birth control and we think that little pill, right? That little birth control pill. Well, in actuality, birth control is anything that prevents conception. So birth control and contraception, they're the same term. So think about this question. If somebody is sexually active and they don't want a baby, right, and they're having vaginal intercourse, how often do they need to use contraception? Well, of course, we know the answer is every single time, right? It's not when it's convenient. It's not when we want to or, our partner wants to, but every single time. Well, the last time we did that National College Health Assessment and have numbers from it, only 56% of our students reported using birth control the last time they had vaginal intercourse. That puts a large number of students at risk for an unintended pregnancy. So let's look at it this way. Let's say that we had 100 women, we could say 100 Wake Forest women, who were sexually active over the course of the year and used no contraception whatsoever. How many of them might become pregnant within that first year? So take a guess. Think of a number between 0 and 100. So the number is actually 85. And that might really surprise you. Let me tell you what that number is. That is what we call the perfect use failure rate. The number of pregnancies likely to occur per 100 women in the first year of use if a method is used consistently and accurately. So basically, if we're not using contraception, there's a high likelihood that pregnancy can occur. This time in a woman's life, late teens, early 20s, the body is actually primed to be pregnant. However, emotionally, socially, probably not ready for that. So we want to think about contraception every single time. Here's a list of contraceptive methods. And we can see here that there's one foolproof method, right? That's abstinence. Of course, if you're not having vaginal intercourse, you are not going to get pregnant. However, many of you might already be sexually active or may become sexually active in the future. So it's certainly worth having knowledge, right? Knowledge is power. So we want to know what some of these methods are. So the most commonly used form of birth control are barrier methods like condoms, right? So of that 56% of students who were using birth control, 76% reported using condoms. That's good news. A condom is the only form of contraception that also prevents against sexually transmitted infections. So it has a dual purpose. So that's a good thing. 66% of those students were using some kind of hormonal contraceptive, most likely the oral pill. 67% said they used a condom plus another method. Again, that's good news. Remember, hormonal contraceptives or things like an IUD, they don't give any protection against STIs. So even if a woman is taking a hormonal contraceptive, you still want to use a condom because it gives that STI protection. So let me walk you through something called the fertility awareness method. Okay, so first I want to say that this is actually not a great form of contraception, but it does give us a general understanding of the menstrual cycle and how it works and when pregnancy can occur. So it's good to understand. This method is actually pretty commonly used when someone is trying to get pregnant, when they want to know when they should have sex to get pregnant. So the assumption behind the fertility awareness method, we also call this the calendar method, is that the menstrual cycle is about 28 days, right? That's not for everybody, but that's kind of an average. So about 28 days. So ovulation, or the release of the one egg, is going to happen about day 14, so right in the middle of the menstrual cycle. Now, that one egg that is released stays viable for fertilization for about 2 to 3 days. So if unprotected sex is had 2 to 3 days after ovulation, the woman can get pregnant. Now, sperm can actually live inside a woman's body for up to 5 days. So if unprotected sex is had 5 days before ovulation, pregnancy can occur. So that gives about an 8-day window every month where pregnancy can occur. Now, take a look at the blue areas, right? Does it say 100% safe? No, it says relatively safe. So again, we don't want to rely on this method, but it does give us a good understanding of generally when pregnancy does occur. So we're going to talk about two methods of birth control. They're called barrier methods and hormonal methods. So barrier methods are simply when you put a barrier between a sperm and an egg. So you still have an egg present, but there is a physical barrier stopping the two from meeting each other. Then you have hormonal methods. So hormonal methods introduce a synthetic hormone into the woman's system, prevents ovulation. If she's not ovulating, there's no egg, so pregnancy can't occur. So barrier methods, we're going to talk about the condom. There are others, and you can look at the slides on Canvas if you're interested, but the most commonly used is going to be the male condom. So these are about 82 to 85% effective with typical use. So what does that mean? That means they actually fail 15 to 18% of the time with typical use. So if used perfectly every single time, they're going to be much, much more effective. So why do condoms fail? Well, first of all, you don't want to store a condom somewhere where it's very warm, there's lots of movement. Think something like a wallet, right? You take it out of the wallet, it may have a small micro tear in it already because it's moved around inside the package. It's certainly not going to be effective. Secondly, condoms do have expiration dates. Make sure to check the expiration date. Now, an expired condom is certainly better than not using one at all, but you want to make sure that it's not expired. Also, you don't ever want to use an oil-based lubricant with a condom. It's too harsh, it could cause it to break, so always stick to water-based lubricants. Like I said, condoms are a contraceptive protection that also give STI protection, so it has a dual purpose. Now, that STI protection is highest when the condom is latex. So if possible, choose a latex condom. There are non-latex types, of course, but if possible, choose the latex. Now, there's another kind of condom, female or internal condom. Okay, so it looks a little bit different. You can see the picture there. There's a small plastic ring at the bottom. So what would happen would be the woman would squeeze that together and insert it into the vaginal canal, much like a tampon. So it gives that barrier protection. Now, it's not as form-fitting. It certainly does move around a little bit more, so the protection isn't quite as high. Typical use, it's about 79% effective. But it does give some STI protection. Now, these typically will not be latex, so the STI protection will not be quite as high as the male condom, but it is another option. It's another type of condom. So now we have hormonal methods, right? So these are things that require a prescription. a woman would need to go to a doctor and have a conversation. Remember, if you're sexually active, that's a health issue. You need to have those conversations with a physician. So these require a prescription because not every woman should take hormonal contraceptives. That's certainly, again, a conversation to have with a doctor. But these contain synthetic hormone, estrogen or progestin, and they're introduced into a woman's system, and they prevent ovulation or a fertilized egg from implanting. They're typically very effective, 92 to 97%, 97% effective if used correctly, but they don't give any STI protection. So there are several different types of hormonal contraceptives, and we already mentioned that the oral contraceptive pill is by far the most commonly used of the hormonal contraceptives. There's lots of different types out there on the market. Typically, they're a pretty low dose of hormone, and there really aren't a whole lot of side effects. So typically they're 28 days, 21 are hormonal pills, and then 7 are placebo. It is important to take every pill and try to take it around the same time every day, simply to keep yourself on a schedule of taking it. Now, let's say that you walk into a friend's room and you see a pack of pills sitting on their desk. Can you assume that person is sexually active? The answer, of course, is no, right? These are prescribed for a lot of different reasons. They might be prescribed to regulate menstrual cycles or to reduce pain from menstrual cycles or even things like acne. So don't make any assumptions if someone is taking an oral contraceptive pill. There are patches, there is the ring, there's the injection, the Depo-Provera injection. Now, the Depo injection gives 3 months worth of hormonal contraception. The thing is, it has a few more side effects than some of the shorter acting contraceptives. So if you haven't ever tried a pill or a patch, you probably wouldn't want to start with the injection first, just because, again, it gives 3 months of protection, and once it's in, you can't remove it from your body. The implant is becoming pretty popular. This is about 99% effective. So one of our most highly effective forms of contraception outside of anything permanent, like having tubes tied. But it's put right underneath the skin of the arm. And again, about 99% effective, and these are becoming a bit more popular. So another contraception that's about 99% effective is the IUD, or the intrauterine device. So this is a small plastic flexible device that's placed in the uterus by a doctor and can be left there from anywhere from 3 to 12 years. So this is a long-term contraception. There's 2 types. There's copper that can be left in 10 to 12 years, and then there's hormonal that can be left in for 3 to 6 years. Now, the copper IUD has a pretty simple way that it works. Copper is actually toxic to sperm, okay? Hormonal works very similarly to your hormonal pill or your patch or your hormonal contraceptives. But again, this is an option that provides long-term contraception, but no STI protection. Emergency contraception is an option in the case of unprotected sex, is most effective within 72 hours after, say, a condom breaks or sexual assault. Now, as the name implies, Plan B is probably the most popular and we've heard of. This is always your Plan B. You always want to be proactive in your contraception. However, this is an option. Now, how Plan B works, it is a strong dose of hormones, right? So it keeps the sperm and the egg from fertilizing. It is not an abortive agent. If that fertilization has already taken place, this will be ineffective. There are other brands. There's Take Action. That's also over the counter, like Plan B is. Ella is by prescription only. So if you were to use emergency contraception, again, you can get it at a pharmacy. Have a conversation with the pharmacist there or the nurse at Student Health. Make sure you're comfortable with how it works before you use it. So how do you choose? There's so many methods. Like I already mentioned, sex is a health issue, and this is a conversation you should have with a physician. and choose a method that is right for you. If you thought you might be pregnant, it's certainly important to know to take a test. If you're on campus, you can certainly go to student help, but have conversations with your partner or your family members or a friend or even a counselor about your thoughts and your feelings and your choices. Use that social support, use the resources that you have, whether it's at home or on campus. Okay, so let's have a quick summary. So your most effective contraception are going to be that implant and the IUD. Those are both about 99% effective. Certainly that's outside of anything permanent. Followed by your hormonal contraceptions like the injection, the pill, the patch, the ring. Followed by your barrier methods of the male condom, the female condom, and then the very last would be the fertility awareness method. So let's move on to talking about sexually transmitted infections. So sometimes we don't like to talk about this because we think, oh, it's dirty or it's gross or we shouldn't talk about this. But what we need to understand is that these come from germs. Just like anything else comes from a germ. You get the cold from a germ. Maybe you get the flu from a germ. You get an STI from a germ. But you can transmit germs in so many different ways. Right? So even ways that we might not consider sexual in nature can still pass STIs. Here's the thing. When we're talking about pregnancy, of course, there's one way to get pregnant, right? Vaginal intercourse. When we're talking about STIs, we really have to broaden our definition of sex. So no matter what sexual behavior, whether it's vaginal sex or anal sex or oral sex, no matter who your partner is, you can still transmit STIs. So we're really broadening our definition of sex. So there's lots of different types of STIs, and we, again, are just going to hit the highlights, stick to the basics. But one of the main points is highlighted here. In the United States, you have a 1 in 2 chance of getting an STI by the age of 25 if you are sexually active. Okay, so these are common, probably a lot more common than we ever like to think. Your age group is the most likely to contract an STI. You're more likely to have sex without protection. Maybe you have multiple sex partners. And I don't mean everyone is sleeping with everybody at Wake Forest, at least I hope not, but you may have multiple longer-term relationships. The more partners you have, the higher your risk. Maybe no one's ever told you what STIs are or how you get them or how you can get tested or treated. So maybe there's just not knowledge there. And lastly, if you're engaging in sex while you're intoxicated, of course, you're not making the best decisions at that point. Females are twice as likely than men to become infected with a bacterial STI after one act of vaginal intercourse. And then men having sex with men are at a higher risk for HIV transmission. 25% of all college students have an STI. Take a minute to think about that. Again, probably higher than we think. So there's two types of STIs, and there's a big difference between these two, and there's an important difference between these two. You have your bacterial STIs and you have your viral STIs. So bacterial, the big difference is that those you can take an antibiotic and they go away. Not the case with viral, right? Viral are things that sometimes you will live with lifelong. Bacterial STIs, we're talking about chlamydia, gonorrhea, syphilis, chlamydia being by far the most common bacterial STI, the most common on college campuses and the most common in general. So a couple important things to understand about bacterial STIs. First of all, these are transferred through bodily fluids. There has to be a release of bodily fluids for these to be transmitted. That could be semen, that could be vaginal secretion, that could be blood, but there has to be a release of fluid. Secondly, they're very commonly asymptomatic, meaning you won't have any symptoms. Most men, most women have no symptoms of bacterial STIs. So if you're not tested, you may never know that you have one. But they are curable using antibiotics. So if you had a transfer of fluid and you're just unsure, it's certainly worth getting tested because if you test positive, you can take an antibiotic and it goes away. That doesn't mean you can never get another one, but it does mean that that bacterial STI is cleared up. Now, what if we don't get tested? What if we don't get treated? Are there consequences? Well, there certainly are for both men and for women. There's reproductive repercussions for both men and women, but I want to speak to women just for a second. So there's something that can happen with untreated chlamydia and gonorrhea called pelvic inflammatory disease. So this is an infection that spreads to the uterus and the ovaries, and it can cause scar tissue to build up in that area. One of the most common outcomes is infertility, so not being able to have a baby. Now, pelvic inflammatory disease can be treated, okay? So if you see symptoms, fever, abdominal, pelvic pain, vaginal bleeding, discharge, those are things that can be treated. But if it goes untreated, it can cause infertility. All right, so viral STIs. So the most common of all STIs is a viral STI called human papillomavirus, or HPV. We've probably all heard of this, and most sexually active people will contract it at some point. About 80% of all sexually active people will get HPV. Here's the good news, though. Most strains of HPV are actually low risk. Our body can fight them off. Just like it fights off other viruses, our body can fight it off. It's the high-risk strains that we're most concerned with. Those are the ones that can lead to cervical cancer, can lead to throat cancer. That is what the vaccination targets. Okay, so the HPV vaccine, the Gardasil vaccination, targets the high-risk strains. Typically, it's recommended before someone is sexually active, so around middle school age, but it now is recommended for females and males up to age 45 because the effectiveness has been shown. Here's the important thing to understand about HPV. Unlike the bacterial infections that are transferred through bodily fluid, HPV is transferred through skin-to-skin contact. Okay, so there doesn't have to be the release of that fluid. If there is contact with an infected area and there's a way for the virus to enter the body, it can be transferred. Genital herpes is transferred the same way, through skin to skin. Now, herpes is a pretty common virus, right? Herpes simplex 1 would be cold sores of the mouth. That can be transferred to the genital area. So oral herpes can be transferred to the genital area through oral sex. Now, herpes is a lifelong infection. You may have one outbreak, you may never have an outbreak, but it's always a dormant infection and it can always be passed. Now, it's more likely to be passed if there's an active outbreak, but there is always that risk. Now, our last viral STI is HIV and AIDS. So this is transferred through bodily fluids. So this is not transferred through skin to skin like HPV or herpes. So in the 1980s, people started getting really, really sick and dying. And that's when we first discovered HIV. Well, the good news is that we've had huge medical advances in treating HIV. Now, we don't have a cure, right? But we can treat the symptoms, and now people are living a really, really long time, and we see this more like a chronic disease. There's actually now a prophylactic pill that someone can take if they are at, or if they're having high-risk sex for HIV. It's called PrEP or Truvada. But the big thing to understand, this is transferred through bodily fluids. It's not casual contact. It's not skin-to-skin contact. Transferred through bodily fluids. So how do we prevent against STIs? Well, at this point in your life, the surest way is abstinence, but some of you may already be sexually active. So certainly consider that HPV vaccination if you haven't already gotten it. Reduce the number of sexual partners. The more partners you have, the more likely it is that you will contract an STI or pass an STI. Have conversations. Be willing to talk to your partner about your risk, about their risk, right? There should be open communication. Sex should be within the confines of that healthy relationship where we can have these conversations. and use protection every single time, right? You can use a condom for vaginal sex, anal sex, oral sex. So every single time there should be protection. It's the best protection that we know of at this point. Now, it's not foolproof. If there's skin to skin contact outside the area that the condom is protecting, things can still be passed. However, it is the best protection that we know of. If you just don't know if you may have an STI, if you feel like you might be at risk, certainly get tested. Wake Forest, when you're on campus, makes it pretty easy. You can get tested at Student Health at any time. You can go to their website, it'll give you all the details. So when you're back on campus, you can make an appointment and you can go and get tested. Also, the Forsyth County Health Department comes and does free and confidential STI testing on the second and fourth Tuesday of every month. This is done at Student Health. So when you're back on campus, if you're just unsure, if you want to get tested regularly, second and fourth Tuesday of every month. Now that you're at home, if this lesson has made you think and you think you might get tested, call your doctor, right? It never hurts to get tested. So the big takeaway, sex is risky behavior. So make sure to know your risk, but also take every precaution to reduce your risk.